So John, from your perspective, why is monitoring intermediate AMD so important?
Yeah, Paul, I think we really see the importance of monitoring these patients in the ARADS and ARADS-2 studies, where patients with the highest risk categories have up to a 50% risk of developing wet age-related macular degeneration and vision loss in their fellow eye within 5 years. And so these are the people that almost are half the time going to convert over. And those are the patients that have RP hyperplasia, large soft drusen, patients who have choroidal neovascularization in one eye. Those are all risk factors that put patients into that ARADS 3 and ARADS 4 category, which we need a better way to monitor.
So how do you help docs or others, even primary care, who are working very closely, sending a lot of patients to you? What do you tell them in terms of identification of that intermediate stage AMD patient?
Yeah, well, so first of all, anybody who has wet in one eye automatically gets into that more advanced risk factor category. Anybody that you see RP hyperplasia, pigmentary changes in their macula, they're going to be at higher risk. And then the harder thing is kind of some of these large soft drusen or larger drusen, but it's critical to look at both OCT and clinical examination to identify those. And those are the patients that not only are going to benefit from ARADS vitamins statistically, but also would benefit from more intensive monitoring.
That makes a lot of sense, and those kind of go hand in hand. And the good thing is, I think our profession, especially both, really understand when to put patients on ARADS2 formulations. But I still have questions on it all the time about how to identify it at that stage. And so, like you said, the one large drusen or the multiple drusen, or the case where the one eye is already lost. And I tell my colleagues as well that, think of the one large drusen as at least the diameter of one of the vessels coming off the optic nerve, and that gives them a little bit of a reference for identifying that key patient. So then they can, as you said, not only put them on formulations that may work, but also monitoring at home.